BW Healthcare World. Welcome to the podcast of BW Healthcare World series that are jointly organized with Kaho. My guest today is Dr. Amitha Marla, who's the Director Administration of AJ Hospital Research Center and Medical College in Mangalore. The topic that we will be discussing with Dr. Marla today is based on the careers that we have in the healthcare. So, welcome, Dr. Marla, to BW Healthcare World.
Thank you. Thank you so much. So, greetings from all. Thank you for the opportunity given by Taho for the today's podcast, and it will be my pleasure to discuss some things related to healthcare administration and career in healthcare. And I hope it will be a fruitful discussion and useful to all the healthcare personnels in India.
With your experience, I'm 100% sure that it's going to be a useful conversation. Dr. Mala, before we get into the serious conversation, let's try and understand what has been your journey from your early education days to entering the field of healthcare. How did you choose healthcare as an industry, as a career? And did everything just turn out to be as you thought it would? Or were there certain twists in your journey that you'd like to share with all of us?
Definitely, sir. The journey for education to healthcare career often like it followed exciting and unpredictable path for me. Post MBBS, after my clinical studies, undergraduate, I was very clear in my mind to join a clinical pathway. But then, because of the family medical experiences, we I had to opt for hospital administration. And to have more clarity, I also studied my diploma and MHA in hospital administration, and then went on to do my MD in Manipal, MD in hospital administration in Manipal. And with this, I got into the field of administration. For a medical person, joining administration was very new those days, and still, I think people are not very keen on joining administration as their specialty post MBBS. But I had taken up this and. Followed this pathway and went into administration, and now around 25 years I'm doing my administration, mainly in the leadership role.
And Dr. Mala, was there any kind of a pushback from the family saying that, you've done your MBBS, why are you choosing admin? Why not you pursue your career as a medical practitioner? Was there any kind of a pushback that you had from your family?
Yes, very much. Because my parents, like the family, would always see you as a clinical person giving patient care and treatment. So, doing an administration was a very new concept for them. And they said, this is not done and you cannot get into administration. Being you can do administration along with your clinical services. But then I was very clear those days itself, for a medical person, you cannot have both together. Doing clinical services and administration is not useful at all, and it's very difficult. So I thought, let me do my administration and fully dedicate myself for the cause of human service.
And do you think that the perception issues of a medical professional choosing a non-medico side of the industry uh, is not seen as positively even today, or things have changed?
There's a slight uh, change. People are accepting the non-clinical persons, but then the careers in which they have to go in are different. For example, clinical people always get a better leadership roles,
Mhm.
and they can work in high with the as directors or hospital administrators or medical superintendents, so with higher roles and responsibilities. The best part of it is that they have a better edge with the clinical experience they have during their undergrad program. So that is why the acceptance level of clinicians among the among the hospital staff is much more when compared to non-clinical persons. But non-clinical persons can get into that role only with good experience and specialization. So with
But
this there is a difference.
But has the perception changed? I mean, are people now okay to get into non-clinical roles? Is it seen as respected as the doctor practicing?
Yes, it is. It is changed a lot because nowadays in the hospitals you see the CEOs and COOs more of non-clinical persons. But
Awesome.
it is an additional advantage only if you when you have an administrative person both with clinical knowledge and hospital administration knowledge. But as I told you, it is very less because when we study our MBBS, we are very skeptical of selecting hospital administration. And another thing is we don't have enough private colleges providing MD hospital administration.
Mhm.
And so that the number of seats for the MD hospital administration also is very less,
Mhm.
and that is one of the reasons which the post MBBS doctors are not able to opt.
Awesome. And let's just move towards the careers in healthcare. Now, healthcare isn't just about doctors and nurses because that's the perception for a layman. If there's a hospital, it's only about doctors and nurses. Can you bring to or highlight some not so commonly known careers in healthcare?
Huh. Yes. So before that, I would just like to talk something about the changes which happened in the healthcare last 10 years. So if you see from 2000, last 10 to 20 years was a most, the year of extremely important changes in the healthcare and hospital industry. So around 2000 to 2005, we saw the technology growing, and it was more of the adoption of information technology, like HIMS in the hospitals, and all this was started. But then around 2008, the country saw a quality revolution. That is the like we had these ISOs and the NABS standards being slowly coming into the hospitals. So those days, the big hospitals were very much interested in having these standards, and where there were good administrators and there was good administrations, we started adopting these standardizations and NABH quality standards. And by 2012, we saw many hospitals going for NABH accreditation program. So this was a big change, and this brought in lot of opportunities for non-clinical persons in the field of quality. And there again later we saw insurance changes in the insurance sectors, that private insurance and government insurance took over strongly. And there again we saw there is the opportunities for non-clinical persons post hospital administration program to take up careers. Then post COVID, what we saw was the technology and innovations, where we saw emerging healthcare technologies creating new opportunities for patient care. So again, opportunities are created for non-clinical and hospital management, or people with the IT background, or with the specialization certificates for healthcare IT. All these saw lot of opportunities in data science and AI, transforming the traditional healthcare role in the hospitals. So all this have created lot of career opportunities now in the healthcare industry.
Yeah, but now can you highlight some careers which are non-clinical? For example, people involved in support activities or administration in the hospital. Apart
Yes.
from doctors and nurses, what are the careers that exist in the healthcare industry?
So apart from doctors, nurses, we have this allied sciences. So allied sciences is one category where the uh, students, as they are studying, go into the technical management of the equipments and patients. So this is one category, and we have around 18 to 20 courses in this, which lot of now people can join in and get into the technical careers in this. Later, when we say in hospital administration, post MBBS, as I told you, we have these clinical persons doing the MHAs and MD in hospital administration, taking up leadership roles. Now, when we say leadership roles, like we have the chief executive officers, COOs, healthcare directors, all these, even health policy analysts. So these are all in the higher roles. Coming to the undergrads, so when we have hospital administration, we have two things, like the for the clinical and the non-clinical. When I say non-clinical, they get into the undergrad, that is the bachelor's in hospital administration, and go into careers which are more related to patient care in the hospitals, but they may not go into the middle level management. They are in the front end, giving patient care services directly. Whereas then when we say postgraduates, when these have better opportunities in the health careers. So this comes again with some specialization. So once they specialize, they have different positions in the hospital. For example, they are employed as operation managers, healthcare or compliance officers. They can work in the field of this purchase and consumables management, healthcare information system managers, digital transformation coordinators, quality managers. Again, very very common for post healthcare hospital administration students to join, medical billing and coding directors. So these are the various middle level manager opportunities the post hospital administration students can get in an hospital. Other than that, they also can join as in teaching as faculty also.
So it's clearly that it's not every job in a hospital or in a healthcare delivery institution deals with patients.
Yes,
It is beyond that. There could be somebody who's dealing with finance, and somebody else who could be dealing in IT or many other activities which are there to efficiently run an institution. You know.
yes,
So,
yes,
so
yes.
my next question to you is, Dr. Mala, what are some of the key educational pathways for someone who is looking to build a career in healthcare delivery institution?
Key educational pathways should be like the uh, as I told you, it is post after the MHA. It is very much required is the specialization. So let me start it like, and the undergrads, they have various programs like bachelor's in healthcare administration, business administration with healthcare focus, that is also called BPM, then public health administration, again undergrad level, and health information management, again undergrad level. So these are for undergrads. So following their the 12th, they after they pass their 12th standard, so they can be from the physics background, or they can be from the statistical background, and then they join for the bachelor's program. Then we have the post grad programs, that is for the clinical people. We have the MD and the DNB in hospital administration, and we have the MHAs and MBAs in the hospital administration. So these again come from various universities as Masters in Healthcare Administration, Master of Business Administration, Master of Public Health, and we have the executive leadership programs from the IIMs and the international institutions. So these are the basic ways in one has to complete their degree for getting any to start with their career in the healthcare. Following which, as I told you, there are the specializations can be taken up in technology, in insurance sector, in medical tourism, in quality management, finance, and these are the various areas. As they are training during their MHA program, they should understand that the which interests them a lot, and they can take internship programs there and do their certification program, because when they join hospitals, it becomes very easy for them to be very clear with the management or the leadership and tell that which area they would like to work and how is their experience in that area. So that is one way in which the career pathways are identified and then transformed correctly in an healthcare administration.
And Dr. Marla, in the typical corporate world, when you're looking at students who are now growing and building careers, they look at a lot of networking within the industry. They also look at mentoring. Uh, what do you think is the best way for someone who is aspiring to become a healthcare professional, for them to network in the with the focus of healthcare industry, and how do they find mentors who can help them nurture their career?
Yeah, so it all starts during their studies again. So as they finish their degree with their MHA, they have these internship programs. So the internship programs varies from 6 months to a year. So wherever they have the internship programs, they should be able to select good hospitals and join these hospitals where there are good administrators to mentor them. So this will give them a lot of exposure to the operations aspect of the hospital. Another way is like to join some any good hospital as a with an observership for 3 months to 6 months, again for the learning of the operations and various other management skills in the organization. Following that, we and the other important aspects are networking. So we need to understand the industry experts, talk to them timely, and maybe also join lot of workshops and training programs where you will come in contact with people with same common interest, and the discussions about the industries happen, and then specialization also happens where the teachings are considered from various experts. Other than that, we also need to have collaborations and joining certain good organizations nationally and internationally with membership, so as to we get the updates and understand the changes in the industry regularly. Then the last thing would be like having updates from global organizations like WHO, CDC, ISQA. So there are various such organizations where we can join as membership, and also we get lot of updates from them regularly. And these things keep us in an understanding with the global happenings and the changes in the healthcare which happens time to time.
And Dr. Marla, healthcare is one industry. In fact, most of the industry, there are these skills that you need to master, and then there are these soft skills and personal traits that become very, very important for you to become effective in the role that you're playing. Are there any soft skills or personal traits which are essential for a success of someone who's building a career, specifically in the healthcare industry?
Yes, specifically in healthcare industries, when people join in the administration level, very much important is the management and the leadership skills. So first thing I would say, it is important to be a incorporate oneself as a good leader in a team, because teamwork is very very important in the administration and operations. Because in operations we work in for navigating the processes and the protocols among the staffs to so as to get the organization goal or the vision of the organization. So in this aspect, we need to have good leadership skills, which helps us in decision and planning, the resource allocation part, or the understanding of the team. All this is very important in the leadership, with leadership skills. Second is the communication skills. One needs to understand it's so important in a healthcare organization because it is a matrix organization. The organogram in the healthcare is a matrix where you have to be have overlapping. The hierarchy overlaps a lot, and then so communication is very very important. And also the style of communication, it is very very prone to sometimes conflicts, but the conflicts should be very healthy with good discussions. And we have to follow a lot of hierarchy in the organization. So the communications in the form of letters, memos, or in the form of discussions, meeting minutes, whatever, all these communications should be well learned within the framework of the hospital. And negotiation skills are very important, and this is where the communication plays a role. Discussion with the patients, patient parties, there are a lot of stressful emotions will be there, where we will have to uh, put it in a way in which we can discuss things with a lot of empathy to the with the patients. So these are the things which people who join hospital administration as a career in healthcare should see, that they learn many things in the soft skills. Then we have these analytic skills, again very important, because the with the data we manage nowadays, we need to analyze the data, understand the trends, and then come out with the decision making skills as an healthcare staff. And I feel one needs to develop an emotional intelligence, uh, to develop all the skills which is required for the profession.
That is very, very useful what you shared, Dr. Marla. Now, what are some of the challenges that anyone who is looking at healthcare industry must be mindful of? And they should keep in mind that this is the career path that they have chosen, and they will be bound to face certain challenges. What are these challenges, and how do you overcome them?
Mm, yeah, if anyone, any individual is interested to take up the career in healthcare, definitely they should be very much prepared for facing the challenges and stress in the administration and operations. So, but definitely it is a meaningful job, and it you can do a lot of service to patient and the party. So you this is very important that one has to understand all this comes along when they join the hospital as a career. We, as administrators, we face lot of emotional and mental challenges because of the high stress environment and emotional burnouts, and we see lot of patients suffering, and day to day administration is very stressful. So all these challenges they will have to face. Systemic challenges, again, like we there's a lot of complex, sometimes bureaucracy and hierarchy, which has to be followed and listened to. And regulatory compliance is very high in the hospitals. So there's a lot of pressure from the government as per the regulations are concerned. and hospitals are very resource intensive industry. So we will have the resource allocations are sometimes very stressful, budgeting and handling the day-to-day profit and loss. So all this increases the challenges and stress. Competitions, for example, again a lot of competitions in the industry. These are again challenges which the we have to face. So these professional pressures and all the emotional challenges doesn't make it very easy for people to join healthcare, but definitely the training and the experience, the maybe a good mentorship or the working in a good hospitals may give them the ease of enjoying the job, and also taking it as a dedicated job for the patients.
Absolutely. And Dr. Marla, there are so many specializations. Even if you look at non-clinical, there are specializations within healthcare. How did you choose what would be your specialization or what would be your core? And what advice would you give to the young people who are at a point in time, at a juncture where they need to make choices? And, how do you suggest they should explore the options?
So when it comes to specialization for me, after my post hospital administration program, I was doing operations in an around 400 bedded hospital, that is around 20 years back. And then over a period of time, we are now increased to a bigger strength, more than 1,200 beds. But as I told you, what I saw is as we were working with the operations and patient care, we saw the quality revolution taking place, and the standardizations and implementation of NABH accreditation program was a must for the hospital. So I took up the specialization on quality management and did my certification programs additionally in quality management. And then I had additional training from the Quality Council of India, where again I was selected as one of the assessors, and then I practiced this. All this have, both being an SSC and an assessor, has given me lot of exposure in the healthcare industry and implementation of the standards, understanding the difficulties from both the sides. So all this I took it as a challenge, and took up the quality management as my specialization. And for others who, when as we are joining the career, what I feel is during your studies itself, it's very important you identify which area you are interested, and which area you would like to have your long term vision. And with this you have to specialize and do certain programs, and then only you can get into the hospital for as a career, with this specialization. Because even during interviews and all, we look for personals who have done specialization in certain areas. Otherwise, personals because they have done their MHA or MBAs, it becomes a Herculean task for us to train them in particular areas. Uh, and so when we see candidates who have done their specializations and opt to work in certain areas like insurance, patient care, customer relations, we feel the hospital feels good about it to employ such people, because the we need to advance in all these areas, and everything cannot come from the top, from the administration. So when we have good specializations, or people who have done the specialization, it's a great thing to employ such candidates, and they have very good career opportunities in the hospital industry.
And Dr. Bala, we saw during pandemic that there were a lot of challenges, both physically taxing as well as emotionally taxing. environments for healthcare professionals, not just doctors who felt helpless, but for every person who was working in a hospital. How do
Yes.
you manage the healthcare career's emotional and physical demands and maintain a work-life balance uh, while working in a hospital?
Yes, work life balance has become a very important concept in today's world because of the long and irregular working hours, because of the emotion challenges and exhaustion, we really get into a lot of stress. And I should say that healthcare industry has a lot of females also now working. 80%, 70 to 80% of the healthcare staff are now females. So it is very important that we have a good work-life balance, and this will come with the one is the personal development and emotional intelligence, where we set boundaries for our work cultures, the work management, the type of work we do. The time management is very important, balancing the family and the work. And then certain wellness practices is also important during our during the stressful work pressures. And like as I told you, like practices such as self reflection, self mindfulness, meditations, anger management, stress management. So these are the things which will help us to balance our life and work, and also having some good practices on health, food. All these things have given a good life balance, and I do practice them. So I advise all healthcare staff that because of this emotional and mental challenges we have in the hospital atmosphere and other challenges, the EI should really improve, and we have to work towards having a good work life balance.
And Dr. Marla, what has been the most rewarding part of your job? And are there any stories, incidences, instances that are memorable and something that you like to share with us that affirms your choice and make you feel that you have no regrets of moving into the role that you are doing today?
Yeah, looking back now, sir, I really don't have regrets on being an hospital administrator, because earlier I had my own thoughts about how a female can become an hospital administrator in a man's world. But then I feel that the hands which rock the cradle rules the world also. So I am now comfortable with that. So the best rewarding part is, like, when getting a positive feedback from the patients and staff about their experience, and the satisfaction they get from the treatment they get in the hospital, or the facilities we provide in the hospital. Second would be, like, creating an effective organizational processes. So as administrators, we keep creating the processes, we navigate the processes, and we make meaningful organizational changes. And when that becomes effective, and when things fall in place because of these changes, we get lot of satisfaction with our administration skills. Other things, like, the very important is, like, the any new industrial changes when we are able to implement the technology part, when we are able to implement and be up to the mark in the industry field. So all this makes gives us a lot of satisfaction. And being in a leadership role, I have worked thoroughly in the strategic planning, resource management. Human resource management again is one very very challenging, because we very labor intensive, hospital is very labor intensive, and the challenges with so many staffs, from highly skilled to unskilled staff, is very very difficult, not easy. And plus attrition is very high in hospitals. The brain drain is happening very very strongly in India now. So all this has to change, but But with all these challenges, when we can run hospitals in smaller places, especially tier 2 cities, with the international standards, brings lot of satisfaction.
Any particular incident that you would like to share with us? Some memorable moment of your job that brings a smile on your face?
So it's not about the job, sir. It's like after 20 years, 20 25 years, giving service to the mankind. Uh, I had a different thought from past 2 years to work with the elders in the community, and then because the aging population is again one more challenge for in our society. So to this we I looked around with the NGOs and the old age homes, what is happening and how things are happening for an aged people. So we worked around that, and then I created an elders engagement community platform. So this transformed my perception, and like I realized, it's not only the administration or the treatment and the other day-to-day operations is important. It is the happiness or the satisfaction you see in the elders. And then once in a month, now we have we call them, we talk to them, we empower them. With all the medical knowledge, general hand holding, and also giving medical facilities for them. So with this, we have around 1,000 elders registered in the hospital today, and we are looking for having more getting more technologically as giving them more help technologically, monitoring them from home. All these new things we are trying to incorporate, and the long term vision is to have a good nursing home or assisted living long term care facility for the elders. So we are also associated with one Via Vikas from Bangalore. They are now coming pan India, and they are a great platform where they work with the elders, and they have made our hospital as a nodal center to take over this program. And this has given me a lot of satisfaction and changing my profession slightly from administration to social awareness and these things.
Thank you for sharing this, because this is very, very beautiful. Because this is a classic case of using your profession, using your knowledge, and having access to the resources beyond financial, and to go make a difference. Making people feel cared can be a very satisfying experience for you yourself. And that's
Yes.
an opportunity that the healthcare, or being in the healthcare, can actually provide to you. That was very beautiful. Thank you so much for sharing. Uh,
Thank
you also brought up, you just said that, bringing in the same quality and experience of healthcare to tier two at par with what the global standards are. Now, how do healthcare careers differ globally, and what are the opportunities that exist for those who want to work internationally?
Yeah. So internationally, globally, healthcare career opportunities will vary with the regional differences. Like if you the opportunities in Europe is more stronger for the doctors, nurses with the advanced healthcare systems they have, and in Middle East, a lot of nurses from India get employed, and their healthcare is rapidly developing, the infrastructure is rapidly developing. So the developing countries have a lot of opportunities to get the career in healthcare there. Southeast Asia is more into IT, and so the career in hospital management, along with IT specialization certificates from international universities, would do a great open great opportunities in South Asian countries, because the medical technology sectors are growing very, very strongly. And other areas like in Africa, where the UN, WHO, public health and development roles are happening more. So all these are global opportunities for healthcare uh, people. But the healthcare system varies from country to country. It's unlike India. It's very advanced in developed countries. So there is need again for certain certification. So, like the masters, we can do the MSc in healthcare administration and masters in healthcare administration, preferably from international universities. And then certain universities gives very advanced degree programs like the CPHIMS, the CHAMPS. These are all various programs which are in the internet, especially in the US. And then we have this online executive programs from the Stanford, Harvard, then the Singapore University, all these things. So these are the certifications very much required if we want to work globally, because we see a big difference when people want to opt healthcare careers globally. India, it is very easy and it is very different, but then India is just coming up with lot of specializations. Universities are now coming up with curriculums with specializations, 1 year course, 2 years course. So till now it was only like the hardcore administrations which was concentrated, but now last 2 3 years we are seeing the specialization part. So globally also it is very important that we do certain advanced certifications. And emerging trends globally is again health, telehealth expansions will be there, digital health collaborations, data analytics utilization. So all these more of AI and IT technologies are going to be incorporated globally, and it is definitely very important to have knowledge in all this before we opt for a career in a global platform.
And Dr. Marla, you spoke about the advancement in the field of healthcare, and we know that technology advancements are happening at a faster pace than ever before. And these technology advancements are happening both in the field of medical, where robotics are now coming into wide use. We are now getting personalized healthcare solutions, uh, but it is also moving towards non-clinical stuff where we are using technology for managing the hospital, procurement, finances, etc. How important is ongoing education and certification in healthcare field, and how do you keep up with such advancements where you imbibe and adopt a particular technology, you get trained in it, you get used to it, and by the time you get used to it, there's something new that has come in.
Critical stuff.
Yeah.
Yeah. So, as I mentioned earlier, post the pandemic, we saw a lot of changes in the healthcare technology. Uh, but in the if you see in our postgraduate programs of MBAs and MHAs, the curriculum is now still not upgraded to having so much data informations and data analytics, and the healthcare informatics is not very strongly incorporated in the curriculums of the universities. And also there is a need for to incorporate the national education policies, where there is lot of emphasis on the specialization, because there itself the students will be encouraged to take up their specialization in the second year, first or the third year, or during internship. So these are the lot of incorporation and changes has to come in our education system, with a credit based system has to start in India. But it is there in certain deemed universities, but when certain universities are still not incorporating it, so that becomes one of the most difficult thing when student wants to go abroad and pursue their specializations. So there are a lot of loopholes on that. Coming to healthcare technologies, again, technology infrastructure is changing a lot, like the cloud-based healthcare systems, this Internet of Medical Things, all advanced uh, infrastructure, new platforms are coming. So all this is becoming very difficult for day-to-day administrators or the people in the career to incorporate suddenly into the hospitals. So we understand the emerging roles and the changes happening in technology, but it takes time to change over. For example, we have this electronic health records, which which is the digitalization thing becomes very difficult with the doctors to incorporate that and change the mindset to get into the digital world. So there, then of course we have this nowadays. The digital health technology is going towards medical imaging analysis of radiology and pathology, and then remote patient monitoring. Advanced telehealth platforms are there. So these are the technologies definitely we want to incorporate, but the transition phase is there, and but the future is technology, and we will have to incorporate it at any case.
And what are some of the emerging technologies that are shaping the healthcare careers in 2024 that the students of today should be mindful of?
The AI powered diagnostic tools, then the robotic and automations, that is the surgical robotic systems, the automated patient care assistant. Then we also would be maybe having more of medication dispensing robots. Then even the precision medicines, like the genomic data analysis is going in a big way nowadays. um, the AI tools for handling risk management in the hospitals is again coming into the risk predictions can be done using this type of AI tools. Then we have this advanced data analytics and utilization for we have this patient satisfaction feedbacks, or we have this the consumable purchase management. Lot of data is there. Medical records data management. So there are various positions now can be created with advanced learning. What is it, like specialization? Like we can have tele health program managers, data analytics strategists, then healthcare AI specialists, digital health coordinators, healthcare data scientists. So all these are new things. Now the hospital will have to incorporate and look for people who have done such specialization and employ them more.
Awesome. I think there are the opportunities in the coming times for anyone to work in the healthcare would be far beyond what we typically understand of healthcare. So it's going to be very different. But before I let you go, one more question that I wish to ask you, and I think this is going to be useful for everybody who's looking at building a career in healthcare is what are some of the tips that you have for excelling in interviews or applications while applying for healthcare roles?
Yeah, like one is the as we prepare for the interviews, it is very important that we one should understand about the organization. So when a candidate comes for an interview, first thing is, like, they should have a knowledge about the type of healthcare organization they are applying to. So what are the services the hospital is providing, what are the different departments. So this type of preparation should be done. Then they also should understand about the certain trends about the organization. Then any specific career they are looking, means they want to work in a specific department, and so these are the preparations they have to do when they apply or when they come for an interview. Then as far as the resume or the application is written, uh, one should have a should have clarity about the certifications or the study programs they have undergone, their professional achievements also, or any specific role or experience they have in the previous hospitals, their internship experiences, their soft skills and technical competencies are very important. So they should update what technical competencies they have, because with so much of IT technologies and challenges hospital is having, we cannot afford to have people more and more with the lack of the technology knowledges. And when it comes to interview performance, I know it is all common everywhere. Like, they should demonstrate their communication skills. They should show their EI, and then have also have a understanding to the healthcare technology they have been using before, or whether they can adapt to the healthcare technology. So this type of discussions has to happen during the interview. And the presentation part, like we they the body language, the confidence, the teamwork capacities, they should discuss or display during their interview.
Dr. Mala, this has been such a beautiful conversation because, let me try and summarize of my takeaways from this conversation. One is that we very aptly brought out that the quality revolution that has happened and the focus that it has brought in on the standards and importance on the quality, it has become extremely important and, in fact, imperative for everyone to start focusing on how efficiently we can manage our hospitals or any healthcare delivery institution. So, the focus on administration today or a hospital administration is extremely important, something that cannot be ignored. Second thing that you brought out very, very beautifully was the personal traits that people should try and understand if they have or they should nurture before they choose healthcare as a career. You spoke about people understanding that they need to have good leadership skills because at any point in time they will have to take lead in decision making. Second is, while they need to have good leadership skills, you mentioned that there has to be an emphasis on teamwork. Because if you look at a hospital, I mean, my understanding is even if you're a doctor or someone who's working with a doctor or somebody who's working in an administration, there are so many different roles that have to come together and work together towards providing whether the patient outcome or efficiency in the hospital, etc. Like you mentioned, that it's a matrix structure that every healthcare institution works like. Then, third thing that you unknowingly touched upon is the knowledge of the SOPs, understanding the compliances or what you are expected to know of, and something which is also undermined, but you played a lot of emphasis on that was communication. You know, uh, Again, it's a matrix structure, so you've got to be having uh, diverse conversations with diverse set of people within the same institution. There will be overlapping roles. There will be times when you'll have to have a conversation with the doctors. There will be times when you'll be conversing with the patient. So, interpretation of what you are saying has to be extremely important so that you are understood in the right manner. And there is no misinterpretation about what you're saying because that could have a long lasting impact, correctness of the information that you share, uh, negotiations that you are doing, then you also brought out something which usually people miss out, and that is the analysis of data, because Indian healthcare institutions are serving a lot of patients. We have that opportunity to collect that data, analyze that data, and use it to the advantage to do to make intelligent decisions while you're working with the hospital. And the last but not the least was the emotional intelligence that people must have. At the end of the day, they're doing something which is going to be touching people's lives. Then you brought out the challenges about working in the healthcare institution, but you also brought out something which was very important for people to understand, that it is a very meaningful job, right? So rather than get bogged down by the challenges that could be there, turn it into a meaningful role that you're going to do that gives you the purpose to overcome the challenges, so that you get the satisfaction of making a difference in people's life. And last thing that you mentioned, which stuck in my head, was the opportunity to create patient experiences. So the role of people not working in clinical side have a huge opportunity to make the journey towards wellness uh, more joyous and less painful one. So I think that's a very important role that every healthcare professional has an opportunity to play. Whether you're a doctor, whether you're a clinical staff, or whether you're a support staff or somebody in the allied services that you said. So thank you so much for bringing all this out, Dr. Marla. It was really nice conversing with you.
Thank you. Thank you so much, sir.